I never got in any trouble at work. No one at work ever knew I had a problem with anything.
I'm a recovering addict, recovering alcoholic.
I had never gambled much, but I won, and I realized when I was there that I wasn't stressed out. So I ended up starting at that point gambling.
I'm an addict in recovery, and I'm mentally ill and in recovery from that.
En fait, c'est difficile pour une personne qui vit avec un problème de dépendance de réaliser soi-même qu'on a un problème.
There's many warning flags. While at work, supervisors would see members coming in late, maybe coming in alcohol in their breath, a lot of absenteeism, a lot of trips to the CDUs, perhaps on a Monday morning. We see deterioration in work. We see secrecy, where members don't want to let others know how much they're drinking. May do that in secret. We see relationship problems. Families are impacted by it. Co-workers are impacted by it.
Généralement, les personnes qui sont autour vont réaliser bien avant la personne qui vit un problème de dépendance qu'il y a un problème. Alors, dans un premier temps, une personne qui fait l'expérience d'un problème de dépendance va se rendre compte par les différents commentaires qu'elle va recevoir d'une personne et d'une autre. Le problème qu'on va rencontrer, en fait, que les personnes qui en font l'expérience rencontrent souvent, c'est que les gens ne parlent pas assez, les gens ne vont pas intervenir assez.
Alcohol was part of the regular social interaction, the anticipation to be going into port, and to the socialization involving alcohol, and yeah, it's to fit in also. And
I mean, the Navy that I grew up in, you know, alcohol surrounded everything that we do.
So there was times when I went to work and I smelled of alcohol, and they were like, "Were you drinking before you came to work?" And I was like, What are you crazy? Of course I wasn't."
I know that when I had to go through it, it was like a matter of I was going to lose my job, and it was like I had to do something.
Quand on parle d'un problème de dépendance, ça ne repose pas seulement sur les épaules de la personne qui vit ce problème-là. La santé, en fait, une bonne ou une mauvaise santé, un problème de dépendance va dépendre d'un ensemble de facteurs. Ces facteurs-là vont bien au-delà de la personne elle-même.
In terms of prevention, it's more than just education. Really, it has to go towards a cultural shift.
I still think today, in 2016, people don't see addictions as a mental health problem. I think a lot of people still see addiction as somebody can't hold his liquor. Or, you know, he shouldn't be like that. He drinks too much, can't hold his liquor.
And sometimes within the military, that hard-nosed, you do what I say, or suck it up, is not the right answer.
When I reached out for help, the captain of my ship at the time was very empathetic, very supportive, and on my side. And the first things that he said to me were that, what can we do to help you get better? And that was vital. When someone reaches out for help, the critical role of the leader is to offer that empathetic, supportive help.
Ultimately, no amount of policy, no amount of education is going to break cultural norms. So that's where the real core to prevention begins, is sort of changing the cultural norms, if you will.
Like, people think, they look at as an alcoholic as, I think they see some decrepit person under a bridge living in a box. They don't realize that, you know, there's so many professionals that have addictions problems, and they're mental health problems. They stem from somewhere else, and alcohol is not my problem. Like, the fact that I used to drink too much, that wasn't my problem. That was what I did to cope with my problem. And I still think the culture looks at it as, oh, you can't hold your liquor. You can't hold your liquor.
If we look at, accepted practices within our culture right now, smoking is a prime example. It was and continues to be an accepted practice, but less and less so. So culturally, we're seeing less and less Canadians smoking, and we're seeing that same reduction within the Canadian Armed Forces.
Parce que la santé, c'est une responsabilité partagée. Et donc, considérant que la toxicomanie, c'est un problème multifactoriel qui part des politiques vers les services de santé, l'éducation, la famille, l'hérédité, ça ne peut pas relever seulement de la personne qui vit le problème de dépendance.
I knew that I had a problem at that time, but I didn't understand what they were trying to do. I didn't understand the program itself.
By taking care of the general health of the people, you're going to make a better person. To make a better person, you're going to have a better soldier, a better technician, a better whatever.
It seems that more and more people are stepping forward, so they know that there's help available. And from my point of view, slowly becoming less of a taboo to come forward.
Absolutely, there's that shift that has taken place. And the leaders and all leaders, and I'm talking about the most junior leader, kind of leading seaman, corporal on up, receive education, receive feedback, shown what's right look like. As Admiral Norman says, when it comes to addiction, mental illness, and supporting our people in their recovery piece. And the message is that when they reach out for help, we want the empathetic help to be out there, to reduce the stigma. By other people sharing their stories, but also when people do reach out for help, the non-judgmental hand to be there to guide them on the way to recovery.
So addictions falls within the spectrum of a mental health condition, and certainly we want to ensure, particularly folks with more complex diagnoses like post-traumatic stress disorder, where there isn't a one-size-fits-all treatment. There's always a risk that there will be folks who may not respond to one type of treatment, become frustrated with the approach, and then look to things like drugs or alcohol in order to try to make the symptoms, go away. But the reality is it just compounds the issue. And so we really need to be cognizant of those suffering from mental health issues other than addictions, to make sure that addictions doesn't become just one other thing on their plate of issues to deal with.
I can remember my commanding officer at the time looked at me and said, "Jeff, you're sick. It's like any other illness. You're sick and you need somebody to help you get better." And I carried that through. He just said, carry an open mind and go get some help.
Well, there's two ways to get help. One is to go see your physician, nurse practitioner. And the other way is to self-refer to psychosocial services and ask to see an addiction counselor or a nurse or a social worker.
For me, when I went to treatment the second time, when I was in treatment, I looked at it as the fact that the military was spending a very significant, like tens of thousands of dollars to make me better. And as much as I wanted to get better for myself, which I needed to, I felt a responsibility to them that if they were willing to, the minute I asked for help, they got me the help I needed, and they spent a lot of money doing it. I felt a responsibility to give it my all.
Before any treatment can be offered, we have to find out what the problem is. So there's always a comprehensive assessment done in the beginning to find out the level of the problem. And then depending on the severity, the number of symptoms that are there, we then recommend an appropriate level of treatment. And there's a variety of different treatments to meet the member's needs at the time. So it's not a one-size-fits-all.
So I was very fortunate, both on the medical side of it and from the addictions team, as well as from my command structure that I had worked for, were very open to me getting help. They knew that this was just going to make me better.
Well, since I got to Sharewater in 2006, I've seen a shift in the culture.
Many of our clients have overcome their fear, their barrier, which was fear of what will happen to them if they disclose they have a problem. They've overcome that, they've come in, they've worked hard, they've made a commitment to recovery, and they end up much happier in their personal life. They end up doing well in their career, they get promoted, and they're just generally happier all the way around. And that's our That's the majority of our clients.
I opened up to what they were saying and really trusted in them that the program was going to help me. And when I did that, it changed everything.
And that's why I come and do these things and volunteer and everything else, because one person is going to be helped. If that one person helps one person, somebody is always going to benefit from this. Either the organization as a whole, an individual, or even myself. It even helps me because I know I'm giving back. It was given to me and I have a solution that works, and I hope somebody else can pick up on that.
It can be frustrating. It can be sad because you see individuals struggling so hard with their problem and sometimes trying to do it on their own without help. So that's the frustrating, sad part of it for me. But it's also incredibly rewarding when you see the benefits of recovery for those who have made that commitment to carry through.
The addictions prevention team and the program up here is fantastic. The people care about what they do, and they focus on trying to help every person that comes in the door up there.
I think it would have been harder in civilian life because I think if I was a civilian employee, I don't think I would have had the opportunity to be sent for a 56-day treatment like this and all paid for. And I don't think I would have had as many opportunity and chances as I had in the military. It was at the cost. I mean, I got charged many times, paid many fines, but just because of the nature of the military, how it works, and the punishment system, administrative system, in a way it really the whole system brought me to where there was an opportunity for me to get better, and they were ready to assist me with that.
The military gave me everything I needed and provided me with so many resources that were out there, as long as I was willing to use them.
Certainly we continue to move forward with the addictions program to address the full spectrum of addictions in an effort to educate and again change those cultural norms within the CAF culture.
The Royal Canadian Navy has invested, I would say, approximately 70 days in recovery from addictions, because I went to a rehab clinic on the West Coast in Nanaimo, and from mental illness. And for those 75 rough days, to date they've had about 3,250 days of healthy service from myself. And my recovery began as a lieutenant. When I reached out for help, I thought my career is over. Well, clearly it's not. And again, it's because the stigma, the judgment, the reduction, the culture change, the acceptance that people can get sick, but they can recover and then become, again, useful members of the Canadian Armed Forces and the department.
I feel the military has the help for the people, but the people have to be willing to want the help to use what the military has.